The 8 disturbing trends facing patients in clinics today. Patient wait times may seem like a small part of the patient experience, but they can have a powerful effect on overall patient satisfaction. A software advice survey of over 5,000 patients found a staggering 97% of responders were frustrated by wait times at the doctor's office. Virtually every patient has experienced wasting their time in a medical clinic. A new survey finds that the vast majority of patients, 85%, say they have to wait anywhere from 10 to 30 minutes past their scheduled appointment time to actually see their doctor. And the waiting period is often the worst part of the doctor's visit, according to patient surveys. So we're going to cover 5 areas in this presentation. Number 1 is we're going to cover the big picture medicine information. And then number 2, we're going to cover 8 disturbing trends facing patients in clinics today. Number 3, we're going to cover the buying criteria when you're looking for a clinic. Number 4, we're going to cover the 6 facts about the Clinics of David. And then the last part, we're going to give you some information about the Clinics of David, telemedicine clinic. So part 1, big picture information. I will begin by quoting Dr. Skorton from the American Association of Medical College. The gap between the country's increasing healthcare demands and the supply of doctors to adequately respond has become more evident as we continue to combat the COVID-19 pandemic. The challenge of having enough doctors to serve our communities will get even worse as the nation's population continues to grow and age. The annual analysis continues to show that our country will face a significant shortage of physicians in the coming years. End of quote. According to new data published by the Association of American Medical Colleges, the United States could see an estimated shortage of between 54,000 and 139,000 physicians, including shortfalls in both primary and specialty care by 2033. Here's another quote from Dr. Skorton. As our healthcare system continues to treat patients during the COVID-19 pandemic, the need for a strong and sufficient healthcare workforce is more apparent than ever. Specialty physician shortages, especially those that are hospital-based, including critical care, emergency medicine, and pulmonary specialists, are particularly urgent, Dr. Skorton said, noting that hospitals in hard-hit areas have had to rely on a patchwork of solutions, including expanding scope of practice laws, graduating students early from medical schools, hiring physicians out of retirement, and relocating physicians from other geographic regions to staff their inpatient units. Now here's a rundown of the projected physician shortage by 2033. For primary care physicians, we're projecting a shortage of between 21,000 and 55,000 physicians. For non-primary care specialties, the projection is between 33,700 and 86,700 physicians. For surgical specialties, the projection is between 17,100 and 28,700 physicians. For medical specialties, the projection deficit is between 9,300 and 17,800 physicians. And for what they labeled other specialties, which include pathology, radiology, and psychiatry, the projected shortage is between 17,100 and 41,900 physician shortage. Now here are other findings from the report. In the demographics side, specifically, population growth and aging continue to be the primary driver of increasing demand from 2018 to 2033. During this period, the United States population is projected to grow by 10.4%, from about 327 million to 361 million. The U.S. population under age 18 is projected to grow by 3.9%, while the population age 65 and over is projected to grow by 45.1% by 2033. Therefore, demand for physician specialties that predominantly care for older Americans will continue to increase. A large portion of the doctor workforce is nearing traditional retirement age, and supply projections are sensitive to workplace decisions of older doctors. More than 2 of 5 currently active doctors will be 65 or older within the next 10 years. Shifts in retirement patterns over that time could have large implications for the supply of doctors to meet the healthcare demands. Also, growing concerns about physician burnout suggest physicians can be more likely to accelerate than delay retirement. If underserved populations were to experience the same healthcare use patterns as population with fewer barriers to access, current demand could rise by an additional 74,100 to 145,500 doctors. This analysis underscores the systemic differences in annual use of healthcare services by insured and uninsured individuals in urban and rural locations, and individuals of differing races and ethnicities. These estimates, which are separate from the shortage projection ranges, help illuminate the magnitude of current barriers to care and provide an additional reference point when gauging the adequacy of the doctor workforce supply. You see, prior to the COVID pandemic, doctor shortages were already being felt by Americans nationwide. According to public opinion research conducted in September 2019 by Public Opinion Strategies for the Association of American Medical Colleges, 35% of voters said they had trouble finding a doctor in the past 2 or 3 years. This is a 10-point jump from when the question was asked in 2015. So to help address the physician shortage, the Bipartisan Resident Physician Shortage Reduction Act of 2019 was introduced in the U.S. Congress to provide increased Medicare support for an additional 3,000 new residency positions each year for the next 5 years. Again, I will quote Dr. Skorton. He said, "The pandemic has shown the importance of investing in a strong healthcare infrastructure to ensure access to care. One essential step Congress must take is to ensure an adequate physician workforce by ending the freeze on federal funding for graduate medical education that has been in place since 1997 that limits federal support for training new doctors." End of quote. Dr. Skorton goes on to say, in addition, our partners in healthcare, especially nurse practitioners and physician's assistants, also have critical roles to play in what must be a multi-pronged solution to increase access to care and ensure our nation is prepared to adequately respond to public health needs and emergencies in the future. End of quote. We move on now to the 8 disturbing trends facing patients in clinics today. Number 1, America faces a doctor shortage that will surge up to possibly 151,000 doctors by 2033, according to the AAMC. In 1990, there were approximately 600,000 practicing doctors in America. And today there are approximately 1 million practicing doctors in America. But the population has increased by about 100 million people in those 30 years. But we have only added a net 400,000 doctors to match that 100 million people boom in 30 years. Number 2, a recent study by Merritt Hawkins revealed the average wait time to see a primary doctor in America's largest metropolitan areas was 24.1 days. Number 3, the wait time for the first appointment with a primary doctor in 15 mid-sized cities was 32 days. But the average wait time per patient in a doctor's office has gone up to 30 minutes past the appointment time. This is tremendous human capital wasted each year. Number 4, the haphazard system of licensing doctors in America is next to none. America is the only industrialized country that dictates a doctor to spend thousands of dollars and resources to obtain and maintain licensure in each state that the doctor wishes to practice in. This is so inefficient, and it limits doctors from spreading their wings to help more patients in states where doctors are needed most. Just think, we can centralize Homeland Security. We can centralize large corporations such as Google. Amazon is centralized. Even Medicare and Medicaid are centralized. But we cannot centralize licensing for practicing doctors to add efficiency to the system that desperately needs it. Number 5, America's health system is heavily focused on disease treatment instead of focusing on life expectancy and prevention. Good luck getting your insurance to cover a dietitian consultation to enhance your health. But the system is built to pay for your cardiac surgery after you have suffered serious heart disease, to pay for your amputation only after your diabetes has ravaged your body. Life expectancy in South Korea has reached 90.82 years for women, while in America, that number is at 83.32 years. Yes, South Koreans have a longer life expectancy than Americans. Number 6, timeliness, which is an absolute expectation in most other professions, just doesn't seem to be the standard in healthcare. Yes, we are better at determining the landing time of a Mars rover than controlling our wait time in the doctor's office. Patients must wait upward of 30 minutes, feeling vulnerable in many cases. What a preposterous waste of human capital. Is this loss of time significant? Yes, it is very significant. According to a study by Harvard Medical School, the typical visit to a doctor consumes 121 minutes of the patient's time. And they broke it down to 37 minutes in travel time, 64 minutes waiting for care or filling out forms, and only 20 minutes face-to-face with the doctor. Dr. Nishad Raman said, decades of productivity and billions of dollars are potentially being flushed down the drain every year. We must face the reality that we are harming our patients and placing unnecessary strain on our healthcare system. It's past time we do something about it. Number 7, healthcare spending continues to spiral out of control. A survey by Investopedia in 2020 revealed the number one cause of bankruptcy in America was expensive medical bills caused by a disability or illness. The U.S. spent $3.5 trillion on healthcare in 2017. That number was $666.2 billion in 1990. Remember that patients pay the doctors, and the more debt-ridden doctors are, well, the more patients will have to pay. The entire system becomes more expensive. You see, the average medical school debt for the class of 2019 was $201,490, according to the most recent data. And this data came from the Association of American Medical Colleges. In 2003, the median debt burden for graduates of public medical schools had risen to over $119,000, while that for private medical school graduates had increased to nearly $150,000. This was back in 2003. So medical school debt for the average graduating doctor has doubled in the past 2 decades. Number 8, the population of the United States has exploded over the past 40 years, but the number of hospitals has decreased. The population in 1975 was 227 million people, and there were 7,156 hospitals in the United States. In 2020, the U.S. population has reached 331 million people, and the number of hospitals has decreased to 6,090, with a total admission of 36,510,000. Now, the 5 things to look for when seeking a healthcare provider. Number 1, make sure you can schedule an appointment using the internet or technology only. Because if the office is not technology sound, it is unlikely they will be efficient with today's technology to save you waiting time in the clinic. Number 2, make sure that the doctor believes what you believe. You have a choice in your healthcare provider. And medicine has basically worked as a mechanic shop for the body. But you are more than just a body. There is more to you than that. You should see someone whom you can connect with at a deeper level. Number 3, sitting in a clinic and waiting to be seen is no longer acceptable in 2021. Study the wait time of that clinic. I mean, this is 2021. And your time is just as important as that doctor. So you need to demand a doctor who has considered your time in establishing a patient-friendly appointment system in their clinic. Today's technology allows for patient-doctor appointments to result in 0 clinic wait time. Number 4, communication is everything in healthcare. Make sure you choose a doctor that you can communicate clearly with. This is your health we're talking about here. So you must partner with someone you can communicate with clearly and easily. Number 5, online telemedicine is here to save you time, to add efficiency to the system, and to give you convenience for minor medical needs. Demand the telemedicine option of care in 2021. COVID continues to ravage the country, and herd immunity is at least months away. So if you can be seen online for a minor medical need and skip the traditional clinic and potential exposure, then choose the telemedicine option. Your life can depend on it. Now, here are some facts about the Clinics of David. The Clinics of David is a patient advocate healthcare facility and clinic, and we believe our patients must experience 0 wait time. The Clinics of David is your firefight against disease. We consider ourselves more than just a mechanic shop for the body. We nourish the human soul as well. With our original poetics, our mini documentaries of people who overcame major challenges, so we can learn and be motivated, and yes, nourish our souls. We are building an army of Davids and Marys because we believe we can stand in support of each other. So when one of us is afflicted with disease, which is a major Goliath that tries to destroy us, we believe in the power of prayer in addition to your health care. And we post our daily prayer for the sick on Facebook and Twitter each day. We believe medical science plus faith, support, happiness, and vigorous lifestyle, and standing strong together contribute to a stronger immune system. And we can win the battle against disease. And we can stand together with others who are suffering as well. Our mission is assurance to the afflicted. The Clinics of David mission. The Clinics of David is a leading physician telemedicine clinic in the United States and a leading patient care advocate in the area of driving down clinic wait times for patients. We believe the medical clinic should be embedded in a facility that includes a gym, an Olympic-sized pool, a dance department, and a music department. Our vision is that people will engage in activities that strengthen their health, fight disease, as well as add happiness to their souls. So instead of visiting the doctor only once or twice per year, the person is plugged in with a wellness center, and this allows them to stay actively attached to the cutting edge information that comes to the doctor that is now pointing to advantages such as the possible delaying of the aging process. Yes, technology now is pointing us in that direction. This vision can be accomplished under one roof, we believe. The Clinics of David supports the bipartisan Residency Physician Shortage Reduction Act of 2019. And this was introduced in the U.S. Congress to provide increased Medicare support for an additional 3,000 new residency positions, residencies training for doctors, each year over the next 5 years. For additional information about the Clinics of David, please access theclinicsofdavid.com. Thank you.